the point made towards the end of Peter's report there about how the virus is disproportionately affecting BME communities. We can speak now to James Nazroo, who's a professor of sociology at the University of Manchester. I suppose the first question would be, is that disproportionate effect visible in other countries, including, for example, the UK? I mean, I'm conscious that a lot of doctors, nurses and other frontline workers who've died so far have been BME individuals.
Yeah, so we don't have any clear evidence yet in the UK, but I would not be surprised if we do find similar inequalities apparent in the UK as we found in North America. But it's likely that this is going to be an issue in most countries across the global north.
And why is this?
Well, there are a number of potential explanations. One you've kind of touched on, that ethnic minority people might be in locations where they're more likely to be exposed to infection. So living in concentrated areas in cities or working in particular professions. We know ethnic minority people in the UK at least are more likely to be working in the health professions. But there are much bigger and more important underlying reasons which relate to the social and economic inequalities faced by ethnic minority people across the global north. So the poorer social and economic locations that they are in makes them more at risk of illness, of any illness. And of course, that includes COVID-19 infections. But importantly, it also means they're more at risk of the underlying conditions that aggravate the effects of COVID-19 and then lead to a much more difficult experience if they get an infection.
Well, that's a very sad analysis. Do you think that this has immediate policy implications in terms of day-to-day how the government and how hospitals and how public transport and all the other essential services should be operating its duty of care towards its staff?
Yeah, so obviously all of these institutions, all of these employers do have a duty of care to their staff, and they do need to think about the ways in which that duty of care is carried out, and that includes care workers as well, of course. But there are also kind of implications around the ways in which we think about the provision of health services and making sure that health services are targeted to those communities that are most at risk. And that might be particularly an issue in the United States, where the health insurance system creates additional difficulties for ethnic minority people to access health services.
And that I mean, obviously that is not replicated in the UK, where we thankfully have the NHS. But are those problems replicated in other countries of what you've described as the global north?
Well, it's replicated to varying extents across different countries, depending in part upon their healthcare systems. So there are negative experiences in relation to healthcare in the NHS context as well, even though these may not be as great as those in the United States. And we'll see the same in other countries, even if they do have some kind of population-wide healthcare coverage. Yeah.
Thank you so much for bringing us your expertise on this very important issue, James Nazroo. Thank you for joining us.